Hello everyone, this is Dr. Ankita Singh, Reader, Department of Oral Pathology and Microbiology, Babu Banarsidass College of Dental Sciences, Lucknow. Today's lecture is on differences between primary and permanent dentition. So this is a slide which shows primary and permanent dentition. Primary teeth are also called temporary milk deciduous or baby teeth. They are present from infancy stage till early teenage and they maintain space for eruption of permanent teeth. There are significant differences in different aspects to distinguish them from their permanent counterparts. So this is the slide which shows all your primary and permanent teeth. Number of teeth present in primary set is 20, in permanent it is 28 to 32. Bicuspids and third molars are absent in primary set of tooth. Primary teeth are smaller in size when compared to the permanent teeth. So this slide shows the dental formula for primary and permanent teeth. So primary teeth consist of central incisor, lateral incisor, canine, first and second molar. Permanent teeth consist of central incisor, lateral incisor, canine, first and second premolars, and first, second, and third molars. Primary teeth are smaller when compared to permanent teeth. Primary teeth are white in color because enamel is less mineralized and opaque, so it does not reflect the color of the underlying dentine. And your permanent teeth are yellow, white, or gray, or brown because enamel is more mineralized and translucent, so it reflects the color of the underlying dentine. Primary teeth is bluish white in color, refractive index similar to that of milk. Permanent teeth is grayish white to yellowish white in color. Primary teeth are smaller in dimension, permanent are larger in dimension. Primary are wider mesiodistally in relation to cervico-occlusal dimension. That gives a cup shape appearance to anterior teeth and square shape appearance to molars. And permanent teeth are larger in cervico-occlusal dimension. This gives a longer appearance to permanent anterior teeth. In primary teeth, cuspids are slender and more conical. Permanent teeth, cuspids are less conical. In primary teeth, cervical ridges are more pronounced, and permanent teeth, they are flatter. In primary teeth, buccal and lingual surfaces of molars, especially first molar, converge towards the occlusal surface, so they have a narrow occlusal table in buccolingual plane. And in permanent teeth, there is less convergence of buccal and lingual surface of molars towards the occlusal surface. In primary teeth, occlusion plane is relatively flat, and in permanent teeth, occlusal plane has relatively curved contour. Primary teeth molars are bulbous and sharply constricted cervically. Permanent teeth, they have less constriction at the neck. Contact areas are small, situated more gingivally in primary teeth. In permanent teeth, they have large contact area and it is situated more occlusally, mostly between middle third or junction of middle and incisal third. Primary teeth, supplemental grooves are more and they are less in permanent teeth. Mamelons are absent in primary teeth. Mamelons are present in incisal edges of newly erupted incisors. So this picture shows the mamelons on newly erupted permanent central incisor. So deciduous teeth are more bulbous, wider mesiodistally. Facial surface and lingual surface are flat. Cingulum is more prominent in permanent teeth, but it is not as prominent as in deciduous teeth. Cusps are short, sharp, pointed in deciduous molars but becomes flat due to wear and tear. In permanent teeth, cusp and permanent premolar and molars are less sharp when compared with deciduous molars. The occlusal surface, deciduous teeth, cusp are short and foci and ridges are less prominent. Deciduous molars have shallow occlusal surface. Permanent molars and premolars have deeper occlusal surface because cusps are long and foci and ridges are more prominent. Occlusal area, occlusal table appears narrow buccolingually in deciduous teeth, but in permanent teeth, occlusal table wider buccolingually. Cervical line less curved in deciduous, cervical ridges. Deciduous teeth at cervical third of crown are prominent in all deciduous teeth, especially labial surface of anterior teeth and buccal and mesial surface of molars. Permanent teeth, cervical ridges less pronounced. Cervical constriction, marked constriction between crown and root, making crown appear more bulbous in deciduous teeth. Length of the root, deciduous shorter and cylinder, permanent long. Crown root ratio, roots proportionally longer than crown in deciduous. In permanent, roots appear longer. So furcation, level of furcation near the cervix and deciduous molars, and level of furcation 3 to 4 mm from cervix, or it is placed more apically. This picture shows your milk tooth has chewing surface which is narrow. The pulp chamber is more extended. So this is a picture which shows morphological difference between primary and permanent tooth. So in this picture, you can see the pulp. So if we see the differences of the pulp chamber anatomy in both primary and permanent teeth closely approximates the surface shape of the crown. The pulp chamber is larger in relation to crown size, and permanent teeth, pulp chamber is smaller in relation to crown size. Pulpal outline follows DJ more closely in primary teeth and less closely in permanent teeth. Pulp horns are more closer to outer surface in primary teeth. Mesial pulp horn extends to a closer approximation of surface than distal pulp horn. But in your permanent teeth, pulp horns are comparatively away from the outer surface. You can see high degree of cellularity and vascularity in tissue in primary teeth and high potential for repair in your primary teeth. But in permanent teeth, you can see less degree of cellularity and vascularity in tissue and less potential for repair. Primary teeth comparatively less tooth structure, permanent teeth more tooth structure protecting the pulp. You have your greater thickness of dentine over occlusal fossa of molars in primary teeth and comparatively less thickness of dentine over pulpal wall at occlusal fossa of molars in permanent teeth. In your primary teeth, root canals are more ribbon-like, but in your permanent teeth, they are well defined and less branching seen. In primary teeth, floor of pulp chamber is porous. Accessory canals in primary pulp chamber floor leads directly into interradicular furcation. And permanent teeth, floor of pulp chamber does not have any accessory canal. So this is the picture which shows the morphological differences. Root. Root are larger and more cylinder in comparison to crown size. In permanent teeth, root are more bulbous in comparison to crown size. In primary teeth, furcation is more towards cervical area. We have discussed that. And in permanent teeth, furcation is apical. Thus, root trunk appears larger. So, under physiologic resorption during shedding of primary teeth, so primary teeth undergoes the physiologic resorption, and permanent teeth, physiologic resorption is absent. In primary teeth, root trunk is not distinct. In permanent teeth, it is long and distinct. In enamel, you can see band of red tears, which are less common in primary teeth and more common in permanent teeth. You can see neonatal line in all the teeth in your primary teeth, and your enamel is thinner and has a uniform thickness in primary teeth. In permanent teeth, neonatal lines are only present in first molars. Enamel is thicker and has a varying thickness in permanent teeth. In primary teeth, enamel rods at the cervical slopes occlusally from the DJ, and in permanent teeth, enamel rods are oriented gingivally. We talk about dentine. Dentine tubules are less regular in primary teeth, and dentinal tubules are more regular in permanent teeth. In primary teeth, dentine is thin, variable in thickness. Thickness is half that of permanent teeth. Thickness is limited in some places in primary teeth. And thickness, your dentine is less dense and easy to cut in primary teeth, but in permanent teeth, dentine is thicker. Uniform thickness can be seen. Dentine is denser and difficult to cut. And in permanent teeth, interglobular dentine is present, which is absent in your primary teeth. So cementum. Cementum is very thin and of primary type in primary teeth. Secondary cementum is characteristically absent in primary teeth, but in permanent teeth, secondary cementum is present. In primary teeth, alveolar atrophy is rare. In permanent teeth, alveolar atrophy occurs. In primary teeth, gingivitis is generally absent in a healthy child. In permanent teeth, gingivitis is common in adults. Now the histological differences. Roots have enlarged apical foramen, thus abundant blood supply, demonstrate a more typical inflammatory response in primary teeth. In permanent teeth, foramens are restricted, thus reduced blood supply favors a calcific response and healing by calcific scarring. In permanent teeth. In your primary teeth, incidence of reparative dentine formation beneath carious lesion is more extensive and irregular. In permanent teeth, reparative dentine formation is less. In primary teeth, pulp nerve fibers pass to odontoblastic area where they terminate as pre-nerve endings. But in your permanent teeth, pulp nerve fibers terminate mainly among the odontoblast and even beyond the predentine. In your primary teeth, density of innervation is less, because of which primary teeth are less susceptible to operative procedures. Neural tissue is the first to degenerate when root resorption takes place in primary teeth. And permanent teeth, density of innervation is more. In primary teeth, localization of infection and inflammation is poor in pulp. But in your permanent teeth, infection and inflammation in pulp is localized. So this is your picture which shows histological differences between your primary and your permanent teeth. So that is all for your lecture. Thank you.